This week I had a patient that came in with sudden onset severe abdominal pain. She went to the emergency room. They couldn't find any source of pain. They had told her she had fibroids in her uterus and that could be the cause of her pain. And pretty much after the ER visit she started having vaginal bleeding, which was kind of like a period, but it was too early for it to be a normal period. In evaluating the patient, I did an ultrasound and I found some really small fibroids, which are common for a lot of women to have, and I didn't think that was the cause of her pain. There was some free fluid in her abdomen that can be seen on ultrasound, and my diagnosis was probably she had a ruptured cyst. Now this is pretty common in women, this is why I wanted to talk about this, because it's important to know if someone has sudden onset pain, this is one of the diagnoses we need to think about, other than, let's say, other common things that happen, such as appendicitis. But women form small cysts every month that contains the egg. When that cyst ruptures open, it releases the egg, and that's basically called ovulation. So sometimes during that process you can get some internal bleeding that can cause severe pain. Other times it could be that ovulation doesn't happen and that cyst gets bigger and eventually can rupture, and that can cause sudden onset pain also. In both of those cases, the pain is usually limited, usually gets better over the next few days, generally lasts about a week and goes away. Now for someone that gets recurrence of this, where this might happen several times a year, then what you want to do is you want to stop ovulation. So one of the treatments is to use some form of birth control that stops ovulation, such as birth control pills, birth control shot, or an implant. Therefore, if anyone experiences pain like that, it is important to get evaluated right away. But if it's a ruptured cyst, there's nothing that needs to be done, and it usually resolves on its own.